Good morning, everyone. My name is Christopher Sampson. I'm an emergency physician with MU Healthcare. The most common things we'll see will often be musculoskeletal injuries. So it's people who fall, hurt themselves, or overexerting themselves if they're trying to clear snow or other objects during the storms. So we often will see it in all age groups. It's can be people who are just going out to clear their walk. Sometimes people go out to walk their dog. So really anybody, when it's really icy, it doesn't matter really how young or old you are. It can be pretty unsteady on your feet, and we'll see a lot of slip and fall injuries. Those can be sometimes simple things just as sprains, but also we can see more severe injuries such as fractures, dislocations. Sometimes people can have head injuries or back injuries from those falls. We also see commonly just muscle strains, people overexerting themselves, especially if there's heavier snow from shoveling or clearing their walks. And then motor vehicle collisions as well. Often in those early hours when the snow begins to fall or we're having ice or freezing rain, we tend to typically get a lot of vehicles with slide-offs. Thankfully, those are often more mild and minor injuries, but we can see some severe motor vehicle accidents with more severe injuries as well. And then it's also we will have sometimes cold exposures too, especially with next week with the wind chill is probably going to be quite low and with the temperatures very low. People who are outside for brief periods of time can start to develop frostbite or frost nip. So they'll come in with pain in their toes, pain in their fingers, ears, any of those exposed areas, especially if it's really windy.
When it comes to frostbite, how quickly can that set in if you're outside for any amount of time?
So it's a few factors that play into it. One is first the outside temperature, and then also the wind chill or the wind. Um, if you if you're if it's the colder it gets and the stronger the wind, it leads to less time or that you need for that frostbite will develop. So if it's coming this week when our temperatures are potentially going to be below zero, and if we have a strong wind, sometimes as little as 30 minutes or less outside, you can start developing frostbite. So it's some of those things that's important. People don't realize maybe if they have to get out of their vehicle, change a tire or something like that, or they're outside doing work, that's again appropriately to cover up. So you want to make sure you're wearing gloves, you have good socks, good shoes, hats to cover up those other exposed areas. The first thing with any musculoskeletal injury is if you're having continued severe pain or if you notice a deformity in that extremity, that's a sign to come to the emergency department. For most of cold exposures, if you start having pain, the first thing to do is get out of that cold if you can, get inside a vehicle, go indoors. If it improves, then you're probably doing okay. If you're having continued pain in those areas, then you probably need to seek medical attention. The first thing you want to do is just get inside to a warmer environment. Often that's will be pretty successful. If you need to, you can use warm water. You don't want to do hot water, but you can soak some those the. It's often going to be the fingers and toes. You can put them in some warm water to help warm them up. But most of the time, just getting out and into a warmer environment, your symptoms should resolve within a few minutes. I think people need to know you don't want to run generators in a home. Yeah, you want to always be aware for alert to carbon monoxide poisoning. It's good to have a detector in your home that can give you an early warning. You don't want to, if your power goes out, you don't want to be using things such as your stove to heat the home. Any of those things, if you're using any type of object that should be outdoors inside, it definitely increases the risk of carbon monoxide poisoning. And again, carbon monoxide is you can't see it, you can't smell it, so it raises a big danger. Yeah, things to watch out for carbon monoxide poisoning would be headaches, dizziness, confusion. If it's in more than one person as well, if you're all in the home and you're experiencing same symptoms, that's definitely a sign potentially of carbon monoxide poisoning. If you are concerned, then yeah, definitely you need to first get out of that area. You want to get into where there's fresh air, and then also you need to have that evaluated by the fire department. The biggest thing, as you said, is to be prepared. So if you're going to know you need to clear your driveway or walkways after there's snow, is to have the appropriate equipment, have a good shovel, have agents to melt ice, and then also if initially is just to stay home. So during the storm and the initial hours of the storm, if there's not a reason to be out, you probably should stay indoors. Because most of the time we see people who are out driving and the roads are not great conditions, they'll slide off. And then the other thing is too is if you need to go out and drive, you should probably have things in your vehicle to be prepared in case you do slide off, it may take some time for tow trucks to get you out or for assistance to get to you. So you want to be able to have things to stay warm. So blankets in your car, water, small snacks. Always have a jacket in your vehicle. Some people leave from inside a warm garage and go out driving and never think about they might have to be outside for a brief period of time or longer, and also having appropriate shoes.